Okay, and so you've had lipedema for about 10 years. And what are some of the treatments? Like, I know you've had a couple of surgeries. What other things have you tried to manage the lipedema or to learn more about it?
Actually, I've had 2 surgeries, and both went really well, but realizing it's not a final thing, you have to continually manage it. It doesn't just fix it. Diet is huge. Managing a healthy lifestyle. I do Bikram yoga in addition, which helps, gets things moving and flowing and going. And also compression. Compression is huge. I went a couple years without it after my surgeries, thinking I was fine.
Mm-hmm.
And now realizing I need to get back into the swing of things and wearing my compression. So this last week I started wearing them 6 hours a day, and it's made a huge difference in how my legs feel. The heaviness, the achingness, and the fluid. Didn't realize how much fluid retention I was retaining. So I love the brand that was recommended by both doctors I went to, surgeons, is the Juzo brand, and it's the compression ones.
And that's Juzo.
Yes.
Yeah.
Yeah.
And so, because I know that you had mentioned like not feeling like the surgery was like the total answer, like it helped, and then it is a journey, that
Absolutely.
It's not a destination. And that's true with, like, yes, lipedema, which is more extreme, but any kind of lymph health or lymph balance. Lymph is a lifestyle. Lymph is not a destination. It's not just like, oh yeah, we got you to where you're going and now you're never going to have a problem again.
Exactly.
It is about making the micro adjustments, and they are so easy. Using the right things on your skin, incorporating a few minutes of dry brushing, wearing the compression clothes when you can. All of those things make such a difference in moving the needle so that you are building the lifestyle that keeps these things from being an issue in the future. So then you don't have to crash off the cliff and try and save yourself while you're struggling and flailing through the air. We've put up a guardrail so that you can, stay on track and keep moving in the right direction.
Exactly.
And one of the things that is so exciting to me, so you, with our work together, you've only had your very initial appointment. So it's just been the first hour of hands-on time.
Right.
And you've already had some pretty awesome results. And I did mention, wear some compression. It's going to help with the weight loss, the body contouring, all of those things.
Right.
And it's so funny. I can say that and repeat that till I'm blue in the face, and so many clients will not listen, even though the weight loss and the body contouring are their main goals.
Right.
Or even skin tightening. Any of those things. Wearing the compression makes such a big difference. And so when you had your surgeries initially and you got the Juzo brand, tell me, I'm learning about the tensile strengths, the measure, like how are those measured?
Well, they have different, like post-op surgery, it's a high intensity medical grade. I used Mirena.
Mm-hmm.
And then after that, you're supposed to maintain, and then they recommend the Juzo brand.
Mm-hmm.
And it was the 20-30 gauge. I'm not sure exactly.
Like intensity?
Intensity, yeah. 20-30, which is pretty intense. It's pretty strong.
Mm-hmm.
Now I'm going to go down to the 15-20 and then try that, but still in the lipedema compression range.
Yeah, you said Juzo has a couple of options. They have ones that are specific for lipedema, and regular compression that's non-lipedema that's still medical grade.
Right.
So that's awesome. And I love that you noticed, because you mentioned that you have some other compression that aren't the medical grade, and that the difference even after surgery between the regular compression and the medical grade compression was undeniable.
Huge.
And then in incorporating, since our first session together last week, in incorporating that back into your lifestyle and saying that you're wearing those 6 hours a day, and that's amazing. And that you, again, it's an undeniable difference. So what is that like? Are you feeling it, seeing it? Like, what does that look like?
All of it. My initial reason for coming back to you wasn't so much about the weight loss and the contouring. It was the pain. It was the heaviness. It's the denseness. It's the discomfort. It's the lack of mobility, and I want to live a healthy, active lifestyle. So I do the Bikram yoga, I walk, kayak, and do those things. But I wanted to get rid of the daily aching in my legs. So the first appointment with you, getting things moving and going, started wearing the compression. As much as I didn't want to get back into it, I started
Right, because
wearing
medical compression is not the greatest.
Especially now that it's June. It's like, really? It's summertime?
Yeah.
But I went ahead, started doing it because it was worth, I wanted to feel good again. And it's been 10 days, wearing it 6 hours a day, and not even 24/7, just 6. And just stuck with it. And the difference, every day it progressed and got better and better. And nothing else changed. And I peed and peed and peed. So just
you said every hour?
Oh, every hour for the first couple days. I'm not kidding. I mean, my legs just shrunk right back, like post-op, like right after surgery. They didn't get real big, but it was enough of fluid feeling that a lipedema person can't explain. You don't understand what it feels like internally.
Yeah.
You look at my legs,
fluid,
you look great.
pressure.
You look amazing. And you're like, you don't know what they feel like on the inside. So getting rid of that denseness that I had, and now I feel like I relate it to feeling like I have light, airy ballerina legs. And so I have those again. And I feel like so when I'm doing my Bikram yoga, I can
go higher, move easier.
Well, it just feels amazing. It's just a feeling that a lipedema patient knows what I'm talking about. What that sensation and feeling is. So now that it's like, okay, awesome, I'll wear them.
Yeah, like your body isn't made of what, cement?
It's not, exactly. So I'm waiting for the new ones to come in the mail. Take probably a week, 10 days. And I'm excited. I'm excited
for you. And what I love about that, and what I love about this conversation, and what I'm so grateful, one piece I'm so grateful for about this is, yes, it's June. Yes, no one wants to wear medical compression. Not that you have to. I do recommend, even Target or Amazon. You don't have to go full medical. But when you want the pain relief, the weight loss, the body contouring, committing even 6 hours a day.
Right.
And yes, it's summer. That sucks. You don't want to be hot. Well, guess what? You can do it when you're at home. You can do it you wake up a little bit early. Do it for 3 hours in the morning, 3 hours at night. There's ways to make it more manageable and more easy and not so terrible to go through. It's not like you have to wear head to toe, long sleeve, long pants, black compression out in the summer all day while you're running errands. There's other ways to make it work and still get the benefits.
And the ones I'm wearing are the nude color. So,
awesome.
they come down to the foot, and I just wear I can even wear sandals, my Birkenstocks. It comes down, you can't see the line. It comes pretty far, so it camouflages. So just wear pants.
Yeah, so you can wear you wear them underneath
in the nude color,
clothes.
and it's like, oh well. Then if I want to wear shorts, you just don't wear them. I mean,
or you can wear they do have other, maybe not the medical, but the shorts.
The medical ones, they make the short.
They do have the shorts.
Yeah.
And those go great under skirts and dresses.
Exactly.
And
Exactly. So it's just readjusting, realizing it's a long-term lifestyle. It just is.
Right.
It's just part of, I have to just accept the fact. I don't like it. I don't want to, wear them. I don't want this disease, but it's just accepting it and moving on.
Well, and even like we were talking about for outside of the disease, just lymphatic health in general.
Absolutely.
Just that mindset shift of, yes, some of these things aren't the most convenient thing, but when you compare the scale, right, of the inconvenience, maybe it's a 2 out of 10, but the results, health, body, fitness, physical, mental, emotional, energetic, reproductive, hormonal, like bringing those things back into your awareness is like, oh yeah, the 2 points or like the little bit of inconvenience a couple of times a day is worth maybe not having to pay a doctor $25,000 for surgery in the future, or maybe not being stuck on pain meds for the rest of my life.
Right.
I did want to ask you, because you mentioned the achiness and the heaviness. 1 out of 10, how intense was that? 10 being just excruciating before, and what is it now since the compression?
It was probably an 8, and now it's between a 1 and a 2.
Oh my gosh.
Yeah.
That is massive.
Huge.
Yeah, that's
Huge.
that's quality of life
Yeah.
that there's not words for.
Right.
Yeah, that's amazing. I'm so
Yeah.
excited
Yeah,
for
I
you.
am too.
And
I
in
am so
1 hour
excited.
of body work,
Yeah.
like what's possible for you in the series,
I
I
know.
can't wait.
I am excited.
I'm
Yeah.
so excited.
Yeah.
Well, let's get
Well,
you on the
thank you,
table.
Thank you. Thank you.